Historically, African American men have been underrepresented in the most recent advanced prostate cancer clinical trials. For instance, the number of patients, African American patients enrolled in the most recent clinical trials have been less than 2%. While most population studies have reported that African American men tend to have higher incidence of prostate cancer, they tend to have an advanced stage of prostate cancer at the time of diagnosis. They also have relatively younger age of onset of the disease, and they also have been reported to have poorer outcomes when compared to non-African American patients. Epidemiological studies have reported that African American men tend to have a higher incidence of prostate cancer, a relatively younger age of onset of the disease, an advanced stage of the disease at the time of diagnosis, and overall poor survival when compared to non-African American patients. Most recently, the study by Catherine Smith and colleagues showed that African American patients, when given equitable access to health care, showed similar overall survival and better progression-free survival when treated with abiraterone or docetaxel for hormone-sensitive prostate cancer when compared to non-African American patients. The study was especially unique because of the representation of the patient population. The study enrolled around 54% of African American men, which has been the highest number of African American patients enrolled in any clinical trial so far. Several other studies across various stages of prostate cancer disease or various treatment strategies have shown that African American patients have comparable outcomes when compared to non-African American patients. We feel that such patient-level studies from institutional data set reflect real-world treatment pattern and outcomes for African American patients. Racial disparities in prostate cancer, whether it occurs as a part of routine clinical care practice or it may occur in clinical trial, is driven by multiple factors such as access to equitable health care, socioeconomic factors, geographical location, and healthcare payers. While most clinical trials occur in tertiary care academic center, this limits the participation of African American patients to a great extent. Given inequitable access to healthcare and out-of-pocket expenses associated with various diagnostic tools such as PSMA-based imaging and therapeutic options such as novel androgen receptor antagonists, we feel that this barrier is likely to increase. Ensuring equitable access to healthcare for African American patient population will help reduce this barrier to a great extent and ensure comparable outcomes to non-African American patients.